After 75, many dangerous health problems don't begin with severe pain. They begin with small, warning signs that most seniors ignore. Every day, a little dizziness, less appetite, feeling tired more often. These symptoms may seem harmless at first, but in some cases, they can signal underlying health problems that deserve medical attention before they become more serious. Point 1. Sudden loss of balance. Feeling unsteady while walking is not always a normal part of aging. Frequent dizziness, stumbling, or sudden balance problems may be connected to issues involving blood pressure, the inner ear nerves, medication side effects, or neurological conditions. Falls are one of the leading causes of serious injury in older adults. Even a minor fall can result in fractures, hospitalization, or a long recovery period. After age 75, doctors often recommend paying close attention when balance problems happen repeatedly, especially if they appear together with weakness, blurred vision, confusion, or headaches. Early medical evaluation may help identify the cause before the condition becomes more dangerous. Point 2. Loss of appetite. Many seniors naturally eat less with age. However, a sudden loss of appetite lasting several days or weeks should not always be ignored. This symptom may sometimes be related to digestive problems, medication side effects, infections, depression, or other medical conditions. Poor nutrition can also lead to weakness and muscle loss over time. Point 3. Constant fatigue. Feeling tired occasionally is common, but extreme fatigue that continues every day, even after rest, may be associated with anemia, poor sleep, infections, or heart-related conditions. Ongoing exhaustion can increase the risk of falls and reduce daily activity levels. Point 4. Swollen feet or ankles. Swelling in the lower legs or feet may sometimes be linked to circulation problems, kidney conditions, or heart issues. If swelling becomes worse or appears together with breathing difficulties, medical attention may be needed. Point 5. Unexplained weight loss. Losing weight without trying may sound harmless at first, but unexpected weight loss can sometimes point to underlying medical problems. Doctors often recommend monitoring body weight regularly after age 75. Point 6. Memory problems that suddenly worsen. Occasional forgetfulness can happen with age. However, confusion that rapidly becomes worse, getting lost in familiar places, or repeatedly asking the same questions may require medical evaluation. Early attention may help identify treatable causes sooner. Point 7. Changes in bathroom habits. Sudden constipation, diarrhea, or difficulty urinating may sometimes signal dehydration, infections, digestive disorders, or medication side effects. Changes that continue for several days should not be ignored. Point 8. Shortness of breath during normal activities. Feeling unusually breathless while walking short distances or doing simple activities can sometimes be linked to heart or lung conditions. This symptom should be monitored carefully. If it becomes more frequent. Point 9. Bruises that appear easily. Skin naturally becomes thinner with age, but frequent bruising without clear injury may sometimes be related to medications or vitamin deficiencies. Point 10. Trouble sleeping every night. Long-term sleep problems may affect memory, mood balance, and overall health. In some cases, poor sleep may also be connected to underlying medical conditions, chest discomfort, or pressure. Many people expect heart problems to cause sudden, severe chest pain, but after age 75, symptoms can sometimes appear in more subtle ways, including mild chest pressure, tightness, burning sensations, or discomfort that comes and goes. Some seniors may also experience unusual fatigue, nausea, dizziness, or discomfort in the jaw, back, or shoulders instead of sharp chest pain. Because symptoms may appear differently in older adults, they are sometimes ignored until the condition becomes more serious. Doctors often recommend seeking medical attention immediately if chest discomfort appears suddenly, becomes more frequent, or happens together with shortness of breath, sweating, or weakness. Point 12. Frequent urination at night. Waking up occasionally during the night to use the bathroom can be common with age. However, frequent nighttime urination, happening repeatedly every night, may sometimes be linked to diabetes, urinary tract problems, enlarged prostate conditions, medication effects, or heart-related issues. Interrupted sleep can also increase the risk of fatigue, confusion, and nighttime falls in older adults. Some seniors become dizzy when getting out of bed quickly during the night, which may lead to serious injuries. Medical professionals often recommend monitoring sudden changes in bathroom habits, especially when they appear together with pain, swelling, excessive thirst, or unexplained fatigue. Point 13. Sudden changes in vision. Blurred vision, double vision. Flashes of light or sudden difficulty seeing clearly should never be ignored after age 75. Vision changes may sometimes be connected to eye conditions, such as cataracts, glaucoma, or macular degeneration, but they can also signal circulation problems or neurological issues. Poor vision significantly increases the risk of falls, driving accidents, and medication mistakes. Even small vision changes can affect daily independence and safety at home. Regular eye examinations are especially important for older adults because some eye diseases develop slowly, without obvious symptoms in the early stages. Point 14. Persistent dry mouth. Dry mouth may seem like a minor inconvenience, but ongoing dryness can sometimes be related to dehydration, medication side effects, diabetes, or certain medical conditions. Saliva plays an important role in protecting the mouth, supporting digestion and reducing harmful bacteria. Without enough saliva, older adults may face a higher risk of tooth decay, gum disease, mouth infections, and difficulty swallowing food. Many seniors take multiple medications daily, and some medicines can contribute to chronic dry mouth without the person realizing it. Staying hydrated and discussing symptoms with a healthcare professional may help reduce complications. Point 15. Difficulty recovering from minor illnesses. As the body ages, recovery from infections or minor illnesses often becomes slower, however, taking unusually long to recover from a cold, mild flu, or small injury may sometimes indicate weakened immunity, poor nutrition, chronic illness, or underlying health problems. Older adults are generally more vulnerable to complications from infections because the immune system changes with age. Symptoms that seem mild at first can sometimes become serious much faster than expected. Doctors often encourage seniors to monitor persistent symptoms carefully, especially fever, weakness, breathing problems, dehydration, or confusion that does not improve within a reasonable period of time. Point 16. Sudden changes in mood or behavior. After age 75, sudden mood changes should never be ignored, especially when they appear without a clear reason. Increased irritability, unusual sadness, anxiety, confusion, withdrawal from family activities, or a sudden loss of interest in daily routines may sometimes signal underlying health concerns. These changes can be connected to depression, medication side effects, poor sleep, infections, hormonal changes, or neurological conditions. In some cases, even dehydration or vitamin deficiencies may affect mood and mental clarity. In older adults, family members are often the first to notice these behavioral changes when symptoms continue or become more severe. Medical evaluation may help identify possible causes and provide early support before the condition affects overall quality of life. Many of these warning signs may seem small at first, but paying attention to early symptoms after 75 can sometimes help prevent more serious health problems later on.